The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Dr. Randi Hagerman is Medical Director of the UCDAVIS Mind Institute and Director of the Fragile X Research and Treatment Center. She has more than 20 years of experience in the field of neurodevelopmental disorders and is an internationally respected leader in Fragile X research, including Fragile X syndrome, a genetic condition that is the leading cause of inherited intellectual disability and the leading cause of single-gene autism.
Hi. Thank you for this invitation. I really appreciate the Autism Research Institute, and I'm going to talk about Fragile X syndrome and autism. I come from the Mind Institute in Sacramento, where we do a lot of research on Fragile X syndrome and also on autism. So there's a lot of commonalities and overlap between Fragile X syndrome and other forms of autism. And it's important to understand that autism is very heterogeneous. There are many hundreds of different causes of autism. Many gene mutations have been associated with autism, but there are also some commonalities between those with Fragile X syndrome, whether they're with or without autism, and about 60% of those with Fragile X syndrome have autism. So the commonalities include synapse formation and synaptic plasticity. That's how the synapse responds to environmental stimuli. And there are hundreds of different genes associated with synapse development, formation, and plasticity. There's a balance between excitation and inhibition that is disrupted in both Fragile X syndrome and other forms of autism. The connectivity in the brain can be dysfunctional, particularly connections between the amygdala, the insula, the frontal cortex, and also the somatosensory cortex. So because many of you may not know much about Fragile X syndrome, it is associated with a mutation in a gene called FMR1, which stands for Fragile X Mental Retardation 1 gene. And everybody has this gene because it's very important for neuronal development and also aging. Typically, individuals have a CGG repeat. I'm not sure if you can see this arrow, but on the front end of the gene in this yellow part, there's a repetitive CGG sequence because DNA is like a twisted ladder and the nucleotides are the rungs on the ladder. So there's this repetitive CGG repeat on one side of the ladder. And when it repeats anywhere from 5 to 44 times, this is the typical or the normal range. It produces a normal amount of messenger RNA and a normal amount of the Fragile X protein. Again, this protein is very important for brain development. Now, those with a full mutation, meaning more than 200 CGG repeats, have Fragile X syndrome. And what happens with these excess number of repeats is the gene becomes methylated, and you can see these orange balls on the front end of the Fragile X gene, and this shuts the gene off, so there's little or no message and little or no protein, and it's the absence of the protein that can cause Fragile X syndrome. And this occurs about 1 in 4,000 to 1 in 5,000 patients in the general population, or 1 in 5,000 people in the general population. But the premutation has 55 to 200 repeats, so a bit of an expansion here. And the premutation in some instances can also cause autism, and it is also very common in the general population. About 1 in 150 females and about 1 in 400 males has the premutation. But the premutation is just the opposite of Fragile X syndrome in the sense that it produces too much of the FMR1 messenger RNA. And then it can produce normal levels of protein so that most individuals with the premutation are not intellectually impaired, but sometimes it can be mildly deficient. But the premutation can cause a lot of different medical problems, including Fragile X-associated primary ovarian insufficiency, also called FXPOI, and that is the most common genetic cause of early menopause, that is, menopause before age 40 in women. It can also cause the Fragile X-associated Tremor Ataxia Syndrome, which is a neurodegenerative disorder, also called FXTAS, and I'll show you an example of that. But it also causes the Fragile X-associated neuropsychiatric disorders, or FXAND. And this includes ADHD, ASD, depression, anxiety, chronic fatigue, chronic pain, obsessive compulsive behavior, and this is involved with carriers, and in fact it is another genetic cause of autism, in the sense that the mechanism is not the lack of FMRP, but the mechanism has to do with too much messenger RNA or RNA toxicity. And if we have time, we'll talk a little bit about that also. But this is much more common in the general population, that is the premutation. So it's important, even if a child has a normal IQ in autism, to order Fragile X DNA testing, because you'll find out if there's a premutation or a full mutation. Now, the level of FMRP is shown here. This is in a group of more than 200 individuals who either have a normal allele or a gray zone allele, which is 40. A gray zone is 45 to 54 CGG repeats. So it's right before the premutation. The premutation is, remember, 55 to 200 repeats. And mosaic means that some cells have a full mutation and some cells have a premutation. And then these are individuals with Fragile X syndrome. So as you can see, the level of protein is pretty variable even in the general population. And in the premutation, it can be quite high. For instance, 2 times normal, down to normal levels, or even a little bit deficient, and this can occur in the upper end of the premutation, where the FMRP levels can go down to 50% normal, or sometimes even a little bit less. And these are mosaic individuals, because depending on the number of cells that have the premutation, the FMRP levels will be higher. And then those with the full mutation have little or no FMRP. And the ones that make FMRP are those that are females, because females have a second X chromosome that is normal besides the X with the full mutation. So depending on what we call the activation ratio, or what percentage of cells have the normal X as the active X, they can make variable levels of the protein from their normal X. Now, we think Fragile X is a good model of autism for several reasons. Many children with Fragile X syndrome have ASD. They meet DSM-5 criteria for autism. And many children with autism can be diagnosed with Fragile X syndrome. Actually, it varies depending on what population is studied, but anywhere from 2 to 6% of individuals with autism will turn out to be positive for the Fragile X mutation. Both disorders, Fragile X syndrome and ASD, have large heads and rapid brain growth. The PTEN mutation, which is very important for the rapidity of brain growth, is often dysregulated, not only in Fragile X syndrome, but in many other forms of autism. Those with Fragile X syndrome have problems with hyperarousal, to sensory stimuli, and anxiety. And there are different subtypes of autism that have the same sorts of problems. Both disorders have problems with facial processing and avoiding eye contact. And that's associated with activation in certain parts of the brain that have been studied with functional MRI studies. Both disorders can have a decrease in AMPA receptors generally, and the GABA system, or the inhibitory system in the brain, is typically downregulated in Fragile X syndrome and in many other forms of autism. And glutamate, or which causes activation, can oftentimes be enhanced. Now, FMRP is a regulatory protein, and it regulates the translation actually of many hundreds of genes. So how fast the messages go into their respective proteins. And many of these genes are genes that are associated with autism, that when mutated cause autism. So here's an example. These are some of the genes that are controlled by FMRP, and the genes in the big circle here are genes that when mutated lead to autism. And also in the small circle are genes that when mutated can cause mood disorders or even schizophrenia. And these are also genes whose messages are controlled by FMRP. FMRP is a regulator, again, of translation. So how these messages are translated into their respective proteins. Now, FMRP has many other functions, and its absence can cause dysregulation of several symptoms known to be associated with autism. FMRP translates many hundreds of messages to the synapse, where the messages are turned into proteins, particularly proteins associated with synaptic plasticity. It also controls, as I mentioned before, translation, and it usually suppresses translation. So when FMRP is absent, there's often upregulation of many hundreds of proteins. So in the absence of FMRP, as in Fragile X syndrome, there is increased protein production throughout the brain, including one protein called matrix metalloproteinase 9, or MMP9. There's upregulation of metabotropic glutamate receptor 5 pathways, leading to long-term depression or weakening of synaptic connections. There's actually downregulation of GABA receptors, and this is why GABA inhibition is downregulated. There's dysregulation of dopamine pathways, important for attention and focus. There's enhanced amyloid precursor protein production, or APP. There's increased oxidative stress damage to neurons. So we often recommend antioxidants. There is enhanced release of neurotransmitters presynaptically that can flood the synapse, so that subtle changes of neurotransmitters related to environmental cues may not be detected by those with Fragile X syndrome, because their synapses are flooded with various neurotransmitters. Now, FMRP deficits not only occur in Fragile X syndrome, but in other neuropsychiatric disorders also, including ASD, even when there is not a Fragile X mutation. For instance, in schizophrenia, brain and blood levels of FMRP are often deficient, and actually that the level of FMRP in blood controls the age of onset of schizophrenia, and also the IQ in those with schizophrenia. Hypoxia or low oxygen at birth can lower FMRP levels. Seizures can also dysregulate FMRP and pull FMRP away from the synapse. So seizures in many different disorders that lead to autism, such as neurofibromatosis, tuberous sclerosis, Fragile X syndrome, and even premutation involvement, can enhance the propensity for autism. And we think this is related to FMRP being dysregulated by particularly early life seizures at the synapse. Excuse me. So here's a chart, the upper left-hand side showing FMRP levels as seen in the horizontal line here, and IQ show that the increase in FMRP levels is associated with a higher IQ in those with a Fragile X mutation, be it a full mutation or a premutation. But here in schizophrenia to the right shows that those with schizophrenia in general have lowered FMRP levels compared to the general population. So this is a slide from studies by Fatimi et al. Showing that in autopsy, when they look at the levels of FMRP in various neuropsychiatric disorders who don't have a Fragile X mutation, including schizophrenia, depression, and bipolar disorder, compared to control brains, that the level of FMRP is lower. And here is some work showing that there is lowered levels of FMRP in the brains of individuals, adult individuals with autism, less of a problem in children with autism. But this is important to know that FMRP may be somewhat deficient in other neuropsychiatric disorders, even without a Fragile X mutation. Now, the reason why this is important is when we develop better and better treatments for Fragile X syndrome to counteract the effects of low FMRP, some of these medications may be helpful for other neuropsychiatric disorders without a Fragile X mutation, but with lowered levels of FMRP in blood. Now, this is a family tree to show you when you diagnose Fragile X syndrome, and here's a boy. As you can see here, he was diagnosed with autism first, and then anybody diagnosed with autism should have Fragile X DNA testing. So after his diagnosis of autism, he was found to have Fragile X syndrome. And then once you know that there is a child with Fragile X syndrome in the family, the mother is always the carrier, and she may have a premutation or a full mutation, and this mother has a premutation represented by that dot in the middle of the circle here. Now, we also test other family members routinely, and the sister here turns out also to have a full mutation. She does not have autism, but she has mild involvement from Fragile X because the other X chromosome is normal, so her involvement is less severe than her brother's because she has an extra X chromosome. But as we look through the family tree, the mother has FXPOI, early ovarian failure. She also has major problems with anxiety, which is part of FXAN that we just talked about, and neuropathy, and muscle pain, and lupus, and oftentimes fibromyalgia or neuropathy, and even autoimmune problems are more common in premutation carriers than in the general population. Now, her mother, up another generation, has FXTAS also with tremor and ataxia, but she has normal cognition, and she also had early menopause. And then the great-grandfather of these children, depicted right here, he has FXTAS, and he's also had cognitive decline with FXTAS. So he is now demonstrating dementia and neuropathy symptoms. And so the whole family is actually involved by different Fragile X mutations. So it's important that you have to consider the whole family once you diagnose a child with Fragile X syndrome. Okay. Now, I want to point out that FXTAS, or Fragile X-associated Tremor ataxia, can occur in women. I'm not going to show the video, but her tremor is like this. So it's an action tremor, and when she tries to do something, the tremor gets worse, or when she's positioning, the tremor is worse. And FXTAS can cause brain atrophy and white matter disease, along with dilated ventricles. And actually, there are inclusions that form in the nuclei of neurons, and this is part of FXTAS, And these inclusions can be throughout the brain, and these inclusions stained red here can be in the amygdala also. And even the mouse model of the premutation can also develop FXTAS and these inclusions. So this is a neurodegenerative problem that can happen in about 40% of male carriers and about 16% of female carriers, and it can start in the 60s. Oops, sorry, I didn't mean to show that video because I know that videos don't show well on this presentation. So I just want to point out the spectrum of premutation involvement because it can involve social anxiety and even ASD, particularly in boys with the premutation. ADHD can be in males and females. Rarely do we see cognitive deficits, but these can also occur, particularly if the premutation carrier has seizures, and seizures can occur in about 8% of those with the premutation. Psychiatric problems are common, endocrine dysfunction leading to FXPOI, hypothyroidism, fibromyalgia, lupus, and also the neurological problems can occur, including neuropathy, pain in the lower extremities, chronic pain, migraine headaches, sleep apnea, restless leg syndrome, foggy thinking, high blood pressure, even erectile dysfunction. And these can all occur before the beginning of tremor and ataxia. So we study various environmental problems that can exacerbate premutation involvement, including toxins, chemotherapy, alcoholism, opioid addiction, and we see excessive iron deposition in the brain, and we're studying now as to whether that can occur in younger individuals with the premutation. So there are many biological problems that happen: mitochondrial dysfunction, RAND translation, which can create a toxic protein called FMRP, sequestration of various proteins that can lead to microRNA dysregulation, and we think that leads to some of the autoimmune problems, inclusion formation, and white matter disease. So I'm not going to dwell on premutation involvement except to say that here are two brothers with the premutation, and we did do a brother study. This boy presented with mild autism and the premutation to the clinic at the Mind Institute. His brother here has the premutation, pretty similar CGG repeats, but he had ADHD and anxiety. But we see high levels of ADHD in brothers who are the probands. They present with clinical problems to the Mind Institute. We also see high rates of ASD, but when we look at the brothers who are not the probands, we see a lower rate of ASD. PDD-NOS is an old term used to talk about milder autism, and we didn't see it in any of the brothers who were controls of the probands. But a study of over 1,200 Fragile X families done by Don Bailey showed that those individuals with the premutation had similar rates to those with the full mutation, but less severe, of a variety of problems, including autism, which occurred in 19% of males with the premutation, but far less frequently in females with the premutation. This is 1 out of almost 200 females. So seizures, as I mentioned, occurs in about 8% of males with the premutation, but anxiety is much more common. And these are significant differences compared to siblings in this study without a Fragile X mutation. So now we're going to go to those with the full mutation, and here are 3 brothers from a Hispanic family, and these 3 brothers all have the full mutation. And I like this picture because they're all demonstrating mannerisms that are very common in those with the full mutation, including Stereotypic hand movements or hand flapping can also occur, but unusual movements of the fingers are pretty common. Poor eye contact, so they're often covering their eyes to avoid direct eye contact. They can also be very sensitive to environmental stimuli such as sounds, and they can also do a lot of hand biting or fingernail biting, and these are common features of those with the full mutation. It's important to know that females also have the full mutation. Here's a mother with a full mutation. She actually has a normal IQ. Thanks, Julie. She has a normal IQ, and she has a daughter here with a full mutation. So there are many mothers out there that can have a full mutation. And about 30% of women with the full mutation will have a normal IQ, but they can still have anxiety or depression. About 30% have a borderline IQ, and about 30% of girls with the full mutation can have an IQ less than 70, but usually just mildly intellectually deficient. So when I see mothers with a full mutation, I tell them that they have the best of both worlds, because most of these mothers with a full mutation have a normal IQ, so they have Fragile X syndrome, but a normal IQ. And the good thing is they don't have any premutation problems, so they'll never get FXTAS or FXPOI, which is, this represents the best of both worlds, the best of the Fragile X world, and then no premutation problems. So again, hand biting. This is, I call it a power salute, and they can do that when they're mad. Most of the time, those individuals with Fragile X syndrome are happy most of the time, and that's a very positive aspect of the phenotype. And less than 10% of Fragile X individuals can have a disorder in eating, and we call this the Prader-Willi phenotype. They don't have Prader-Willi syndrome with a deletion or uniparental disomy on chromosome 15, but they have the phenotype of Prader-Willi in the sense that they overeat, they have a lack of satiation, and they can also have fairly severe obesity, just like Prader-Willi syndrome. So hyperphagia, excessive overeating, can be seen in Fragile X syndrome. Now, again, here's a pedigree, and the CGG repeat is below. So this individual on the bottom end of the pedigree, I'm not sure if you can see my arrow here, but she has 29 and 130 CGG repeats. So she's a premutation carrier, and she has a son with Fragile X syndrome and the full mutation, 660. So when the box or circle is colored in, it means they have a full mutation and have Fragile X syndrome. This one just has a borderline IQ and ADHD because he has a full mutation that's completely unmethylated, and this occurs on rare occasion and can lead to a higher IQ. But there are many carriers, as you can see in this family tree, with a variety of problems such as FXPOI, anxiety, and even FXTAS in this great-grandmother here with 30 and 80 CGG repeats. And then her son is 72, and he has FXTAS and dementia with only 85 repeats. Now, in some parts of the world, there's high levels of consanguinity where individuals may marry a relative. And in those cases, we often see both parents as premutation carriers. And that's what we see here in the father having 60 repeats and the mother with 75 repeats. And so we can get double heterozygous females here with 2 premutations. And then here we have a premutation combined with a full mutation. So when a male carrier passes it on, it stays as a premutation. Sometimes the numbers can go up or down. But it stays as a premutation. So you can only get a full mutation when it's passed on by a mother, whether she has the premutation herself or a full mutation. So here we see many mothers that go on to have children with a full mutation. Now, why do we get occasional outbursts of behavior or overreaction to sensory stimuli? Well, this is related to the GABA or inhibitory deficits in premutation carriers. So here's an adult with the premutation who is having an angry outburst because I'm taking too many pictures of him in the photography studio. And he's giving me some nonverbal cues and a power salute as he stiffens his hands that he's going to have an outburst. Now, why is this occurring? Well, when we look at electrodermal studies, and this is in a normal patient without Fragile X syndrome, and this line here represents the sweat response to environmental stimuli, and the vertical lines here represent repetitive environmental stimuli, whether it's noises or lights or sound or even smells. And as you can see, there's a bump here with the first stimulus, and then they habituate. And this is normal behavior in those without Fragile X syndrome. But here is an individual with Fragile X syndrome, and as you can see, there's dysregulation of the sweat response and a lack of habituation. And that's what leads to hyperarousal in individuals with Fragile X syndrome. So the stimuli here actually activate the sweat response, which is a sympathetic response, and there is a lack of habituation. So that's why they can get hyperaroused. They have too much of a sweat response, and that is reflective of the autonomic sympathetic response, and that leads to anxiety and hyperarousal. So anxiety is a big problem too, and we're often treating anxiety in individuals with Fragile X syndrome. So the features can be a long face, long forehead in particular, ears can be prominent. Notice this individual has a teeny bit of strabismus with this, his right eye is looking in, as you can see from the light reflex. And actually when he was diagnosed, and he was diagnosed late, when he went to the ophthalmologist at 7 or 8 years of age, he already had amblyopia in that eye. And then he also had problems with biting his shirt. So you can see the collar here is all chewed up. And that's a very common problem in those with Fragile X syndrome. Okay, so large testicles or macroorchidism is a clinical feature seen in almost all males with Fragile X syndrome. And the top 3 lines demonstrate 180 males with Fragile X syndrome. And as you can see, the testicles start to increase at about 8 to 10 years of age, and then they stabilize at about 16 years of age, so that the testicles are about twice as large as normal, sometimes up to 3 or 4 times as large. And the bottom 3 lines here represent a matching group of normal boys without Fragile X syndrome. So the testicular volume here is usually 20 to 25 mLs in adults, and in Fragile X syndrome, it can be 2 or 3 times that size. So look for macroorchidism beginning early on in puberty and stabilizing at about 15 or 16 years of age. So these are all individuals with Fragile X syndrome. As you can see, some have ear cupping or prominent ears, seen in all racial and ethnic groups. Oftentimes they have a large head in childhood, but they can look very normal. Here are 2 girls with the full mutation. Here's a high-functioning Fragile X male because of his mosaicism, and he actually lectures about Fragile X syndrome. His IQ is in the low normal range, but he does very well. And again, you can diagnose someone with Fragile X syndrome without obvious clinical features. This just shows the spectrum of social deficits in Fragile X. This is a study that showed that 60% of those with Fragile X syndrome had an autism spectrum disorder. These diamonds here represent the communication and social index on the ADOS. And as you can see, that can vary a lot. So some don't have autism. Some have mild autism, used to be called PDD-NOS, but no longer. And here is repetitive behavior in the triangles. And as you can see, pretty much all individuals, whether they have autism or not, have repetitive behaviors like hand flapping or hand biting. So these are very common features: hyperactivity, impulsivity, short attention span, seen in almost all, and of course executive function deficits that correlates with IQ. Those with a lower IQ, they all have executive function deficits. But even those with a normal IQ, such as girls with a normal IQ and Fragile X syndrome, can have executive function deficits. Overreactivity to stimuli, as I showed you, related to GABA deficits and habituation deficits, but they also can have enhanced cortisol release after stressors. Anxiety is seen in almost all, no matter what the IQ. And the more anxiety, that can correlate with autism. So the more anxiety you have, the more social deficits, and oftentimes the more severe the autism can be. So mood instability, excessive outbursts, and tantrum behavior are very common. Now, this is just a study using an anxiety measure called the ADHD. And this light area means they meet criteria if we didn't take their intellectual disability into account. For all of these different types of anxiety disorders. This is males and this is females. And as you can see, social phobia or specific phobia are very common, but obsessive compulsive behavior, generalized anxiety disorder can be seen in up to 50%. I'm sorry, I have to keep drinking this because I have a tickle in my throat. And I'll wait a few minutes to make sure the audio is up, but anxiety is very common in those with Fragile X syndrome and in many other types of autism without the Fragile X mutation. Now, there have been some very nice eye tracking studies using the Tobii eye tracker, where a child sits in front of the computer and the Tobii eye tracker can mark on the computer where the child looks. So here we see typicals. And as you can see, typicals are usually looking at the eye and the mouth, whether the face is calm, happy, or scary. But those with Fragile X syndrome rarely look at the eyes. It is pretty activating to the amygdala to look at the eyes. And that may be one reason why they avoid eye contact. They look at the nose in particular, but if it's a scary face, they hardly look at all. And the size of the bubble here shows the amount of time they look at each area of the face. So there's a big difference between typicals and those with Fragile X syndrome. Now, a recent study that was published this year shows idiopathic autism versus Fragile X syndrome. And a driver for autism spectrum disorder is anxiety. That was seen by Lisa Cordiero and confirmed by this more recent study. And so on the Tobii eye tracker, they show a social scene or an abstract scene. Here, they can also show faces versus a control. And as you can see here in typically developing, those with Fragile X syndrome compared with typicals look the same amount to the social scene, whereas those with ASD differentiate from those with Fragile X syndrome and those with controls in that they look far less at the social scene and more at the abstract scene. Here in Fragile X, when there's more anxiety as measured on the atoms, there is less fixation to the eyes, and also they see more severe ASD. But the interesting thing about it is when anxiety increases, even though they may look less at the eyes, they are more interested in the social scene. So they may be somewhat hypervigilant to the social scene, which we don't see in idiopathic autism. And I think what's related to this is that I've had 10 to 20 patients with Fragile X syndrome that when they graduate from high school, they are voted homecoming king at their high school. This actually has never happened to me in someone with idiopathic autism. And even when Fragile X syndrome is associated with autism, they can still get voted homecoming king. And that's because they have an essence of interest, more so than idiopathic autism, in social interactions, and they oftentimes have many friends in their high school class, particularly if they were mainstreamed. And they have an endearing quality to them that other kids often like them very much. Now, I also want to point out that in many parts of the world, there can be pockets of very high prevalence of Fragile X syndrome. And so in Indonesia, and this is Dr. Sultana Hassan, who is a geneticist in Indonesia. She has taken me into islands where there can be 50 individuals with Fragile X syndrome on an island. I want to talk about pockets of Fragile X, not only in Indonesia, but also in Colombia. We found a pocket of Fragile X near Cali, Colombia, in a village called Ricaurte. And here's a family from that village. So here's the mother, and she actually has some tremor and ataxia. So she has FXTAS, and she has 3 boys with Fragile X syndrome. Here are 2 of the boys. The third boy with Fragile X syndrome is not in this picture. She has a daughter with Down syndrome. But when we screen the whole family, this daughter with Down syndrome turns out to have Fragile X syndrome in addition to Down syndrome. And she had very little language and major problems with shyness and social anxiety, major motor problems because of Down syndrome and Fragile X syndrome. She actually did a lot better with sertraline that I'll talk about in a moment. And so we screened the whole village of Ricaurte, which is just under 2,000 individuals, and found many individuals with Fragile X syndrome in this village of just less than 2,000. And here are many adult guys with Fragile X syndrome. And when I got off the bus, when I first visited this village, I was surrounded by many individuals with Fragile X syndrome. And these are just a few of them. So these are older gentlemen with the full mutation. As you can see, they pretty much have long faces and long and prominent ears. So they definitely show the phenotype. Why are there so many with Fragile X syndrome in this village? Well, we think it's a founder effect. The village was founded by 3 families, one a conquistador family, and these families, I think, had 1 or more carriers, and then through the generations, more and more individuals with Fragile X syndrome were born into these families. So when there is poverty, and oftentimes an isolated area where it's hard for the families to move away, we see sometimes pockets of Fragile X syndrome. So aging in Fragile X syndrome, there's no FXTAS in those with Fragile X syndrome, but we have seen Parkinsonism, and this is seen in about 20%. And both of these older gentlemen with Fragile X syndrome have Parkinson's disease or Parkinsonism. If an individual with Fragile X syndrome has a full mutation that's completely unmethylated and therefore excess messenger RNA, then they could be at risk for FXTAS, and we've seen a couple of individuals with that. So there can be obvious second hits, which can lead to more significant involvement and autism in Fragile X syndrome. So those with Down syndrome or the Prader-Willi phenotype of Fragile X syndrome are much more likely to have autism. And here is a boy with Down syndrome found in this family where this high-functioning male was first diagnosed with Fragile X syndrome, and he's mosaic or high-functioning. We tested the whole family. This sister has a full mutation, but she has a normal IQ, and she's done very well in her career. But this boy with Down syndrome turned out to have the Fragile X full mutation, and he actually has severe autism too. If there's birth trauma or cerebral palsy, we oftentimes can see a higher rate of autism. And seizures, which can occur in about 20% of males with Fragile X syndrome and about 4 to 5% of females with Fragile X syndrome, can also drive autism, perhaps because seizures dysregulate any level of FMRP there is at in the synapses. But seizures are associated with higher rates of autism. Now, if you compare those with idiopathic autism to those with Fragile X syndrome, on MRI, as Heather Hazlitt has done in 52 boys with Fragile X and in 63 with idiopathic autism compared to normals, Fragile X syndrome has a larger caudate. Autism has an enlarged amygdala compared to Fragile X and controls, but Fragile X syndrome did not have a larger amygdala, even in those that had Fragile X syndrome plus autism. But both disorders can have big heads. Both disorders can have excessive fluid around the brain, and behavioral features were similar in those with idiopathic autism without Fragile X syndrome or those with autism with Fragile X syndrome. So the underlying brain structure was different, even though the manifestations of autism were similar. So there are many paths to get to autism. Fragile X syndrome is one, premutation is another, and many hundreds of different genetic mutations can cause autism. But it is important, I want to make sure you understand this fact, that both the full mutation with the lack of FMRP can be associated with autism in about 60%, but even boys with the premutation who don't have a deficit of FMRP but have elevated FMR1 messenger RNA levels leading to RNA toxicity and dysregulation of a variety of proteins, this can also cause autism in those with the premutation. So let's talk about treatment a little for Fragile X and autism. Of course, ABA, we at the Mind here love the Early Start Denver model, or ESDM, and we think that's one of the best for ABA or behavioral interventions, where it takes place in a naturalistic setting at home, where you really emphasize social interactions and language. We think OT, speech and language therapy, and PT can be helpful for both Fragile X and autism. We particularly like prompt therapy, where you do tactile stimulation to the mouth. That can help in idiopathic autism and in Fragile X autism, particularly when there's hypotonia around the mouth, which there is very commonly in both disorders. Whenever possible, we like inclusion into the regular classroom. Oftentimes this will require an aid. For all types of autism and Fragile X syndrome, I recommend antioxidants because we know that there's oxidative stress in the brain of both disorders. And there's a variety of dietary supplements, green tea, blueberries, different antioxidant juices, such as acai berry juice is a good antioxidant. Several multiple vitamins such as vitamin C and E, but also NAC or N-acetylcysteine is a good antioxidant. And Antonio Hardin did a very nice study in autism where he showed NAC was really helpful for the behavior compared to placebo in those with autism. There's a lot of standard medications that we use. Stimulants are helpful in ASD patients about 50% of the time, and in those with Fragile X, about 60% of the time for ADHD symptoms. But it's important to use stimulants, at least in Fragile X, after they turn 5, because sometimes stimulants can cause more irritability and tantrum behavior under 5. And if they have a bad reaction at 3 or 4, that doesn't mean they'll have a bad reaction at 6 or 7 years of age, so they can always be retried. We like to use clonidine to help with sleep, particularly if melatonin doesn't work, but it can also be calming during the day. Guanfacine or Tenex can be calming. Also, comes in a longer acting form and less sedation compared to clonidine. Strattera is another different medication from the regular stimulants, but it can help in those that don't do well with stimulants. And of course, atypical antipsychotics such as aripiprazole or risperidone. These are the two that are FDA approved for ASD. They also work well in Fragile X syndrome. They can help with anxiety, mood stabilization, but we usually try these medications when there's significant aggression at home. And aggression in both disorders tends to occur more for the mother than the father, because I think most kids feel that aggression towards the mother is easier to do and maybe has less reverberations than being aggressive towards your father, because mothers are oftentimes more easygoing and accommodating. So we oftentimes see mothers that are covered in bruises when they come into clinic because of pinching or biting or hitting from their child with Fragile X syndrome. So we like to treat that type of aggression with any one of these medications. Can help with aggression. For anxiety or ASD symptoms, usually sertraline or fluoxetine can be helpful, and I'll show you a study on that. I think SSRIs can be more helpful for those with Fragile X syndrome compared to those with ASD, particularly at a young age. And then there's some new targeted treatments, including metformin and CBD, or cannabidiol, which I'll talk about in a moment. So because we know, and I'm sorry this is such a complicated slide, but because we know that this mGluR5 pathway is upregulated in Fragile X syndrome, the thought was is if we use an mGluR5 antagonist, this would calm down these pathways. This PI3 kinase PTEN mTOR pathway is upregulated in Fragile X syndrome, and this MECERC pathway is also upregulated. So we've used a variety of medications, including mGluR5 antagonists, but they weren't so significantly helpful in those with Fragile X syndrome. We've also used memantine to help with the NMDA receptor deficits. We've also used GABA agonists to upregulate the GABA system. Arbaclofen is one example, and it was helpful in Fragile X syndrome and now being tried in autism. MMP9, which is too high in Fragile X syndrome, can be calmed down by minocycline, an antibiotic, and these are more GABA agonists that we have studied. I'm just going to talk about a few of these. The mGluR5 antagonists that were not helpful in adolescents and adults with Fragile X syndrome are now being tried in young children ages 3 to 6 with Fragile X syndrome on a NeuroNext trial. It's called the Fragile X Learn trial. And this is an ongoing trial at multiple centers throughout the U.S. And we're just looking at it in young children, but we're also combining it with parent-implemented language intervention, or PILI, and that is speech and language therapy done with a speech and language psychologist and also, a speech and language therapist and also an ABA psychologist, done through Skype into the parent's home. And this is received by all the patients at one of the periods in this trial. And then the AFQ-056, which is the mGluR5 antagonist, is given at some times and not at other times, so it's a controlled trial. And then they're on an extension for 8 months at the end, where all of them get AFQ-056. So we don't have the results of this study, but it's really to learn whether the combination of a targeted treatment, particularly at a young age, can improve overall development. We have done a minocycline study, which was helpful in children with Fragile X syndrome. And this has also been tried in autism, but it wasn't successful in Susuito's study. And one of the side effects of minocycline is darkening of the nails or darkening of the teeth, and that certainly can occur in those treated with minocycline. Our controlled trial, which was a crossover trial of minocycline in children with Fragile X, did demonstrate that minocycline was better than placebo to a certain extent over a 3-month period, but it wasn't a dramatic response, but it can be helpful. One of the things that was particularly helpful for is looking at the event-related potentials as a biomarker for Fragile X syndrome. And Andrea Schneider, one of the psychologists here at the Mind Institute, studies ERP and EEG output. And in the minocycline study, there was significant improvement in habituation normal controls in PET scanning, particularly in young children under particularly in young children with with autism. And so we thought the same in individuals with Fragile X syndrome. I was using sertraline to treat young children with Fragile X syndrome when anxiety occurred. But in this retrospective study of 45 children, we found that the trajectory of expressive language over time on the Mullen was much better when they were on sertraline compared when they weren't with sertraline, and the same with receptive language. And this data got us a grant from HRSA to look at a controlled trial of low-dose sertraline, just 2.5 to 5 milligrams per day in young children ages 2 to 6 with Fragile X syndrome, and this trial lasted 6 months. So they were randomized to either placebo or to sertraline. And these are not high numbers, but what we found on the Mullen scales of early learning is this is how many months improvement we saw in those on sertraline compared to placebo. Like here, it's a duck and a frog, and it said to the child, look at the frog, or look at the duck. And on sertraline, compared to placebo, they were more accurately correct on this passive language task, and there was a significant difference on this passive language test compared to placebo. So the outcome measures that are more sensitive may detect improvements that may not be seen in controls. So I just want to, I'm going over a little over time. I just want to say that metformin is a targeted treatment for Fragile X syndrome. We know that it helps type 2 diabetes and overeating and obesity. I tried it in those with the Prader-Willi phenotype. Metformin has many effects, including lowering glucose. When we tried it in individuals, the first 7 patients with Fragile X, it improved language, and now we're doing a controlled trial of metformin in individuals 6 to 25 to see how efficacious it is. And the reason why it works is it lowers the mTOR pathway. And we've even tried it in young children with Fragile X, and it improves their development. We've seen it improve IQ in some older individuals with Fragile X syndrome. And I think I'm going to end there. I'm sorry I didn't have time to talk about CBD, but CBD we're doing a controlled trial on in Fragile X syndrome. It was helpful in open label, as can mindfulness, meditation, and yoga help GABA inhibition. So I'm going there. This is my collaborator slide, and I'm sorry I went a little bit over. But if there's time for questions, I'm happy to answer questions.
Yes, we've got a couple of questions. And first, I want to apologize for my audio problems at my end. Apparently, they were working on our network today, so I was having a little bit of trouble at my end. So apologies to everybody, but we got all the sound, and I really appreciate you going back and repeating those things for me. So just a couple of questions. I know you've probably got to get on with your day. We did get a couple questions about CBD. So if you wouldn't mind just telling us a little bit about the research that you're doing and whether or not people can enroll in the trial, if that's still open, that'd be great.
Yes. So I think CBD can be quite helpful for both individuals with Fragile X syndrome and with autism. We are doing a controlled trial that's funded by Zynerba now for those with Fragile X syndrome. And it is in individuals ages 3 to 18 years old with Fragile X syndrome. And we are enrolling males and females. So if you're interested in this, you can email me at rjhagerman@ucdavis.edu. Hopefully Zynerba will do a controlled trial in ASD. There's other CBD studies going in other parts of the world, such as Israel. And of course, individuals can order CBD from their marijuana store or through the internet. It's good to go to a hemp website. We don't like THC because there's some evidence that that can cause shrinkage of the brain in children, but CBD we think can be helpful. It actually works a little bit like a GABA agonist, but it has a calming effect. It helps with sleep, and it helps with anxiety. In the open labels, in studies in Fragile X syndrome, it helped with hyperactivity, and it definitely can help with tantrums. So we are enrolling now in this controlled trial. It's done at multiple sites in Australia and in several sites in the U.S. So it's going to be open for at least another month and a half. So if you're interested, email me right away. And I can connect you to our coordinators. But it's a topical gel that's rubbed on the shoulders twice a day, so it's easy to use and they don't have to swallow a pill.
Great. Thank you for sharing that information. We got a question here about genetic testing. So if a family wants to seek genetic testing, what exact tests would they talk to their doctor about? And also this person said, great presentation, even with a tickle in your throat.
Thank you. So all they have to do is ask their doctor to do a Fragile X DNA test. It's covered by insurance and Medicaid, Medi-Cal, and it's just a simple blood test, and it's sent off to a DNA laboratory. And if it is positive for the premutation or a full mutation, I would love for you to email me and we can enroll you into studies. Again, my email is rjhagerman@ucdavis.edu. Most physicians will order a Fragile X DNA test anytime there's a diagnosis of autism or intellectual disability, because that's recommended by American Academy of Pediatrics, American Academy of Neurology, and even American Academy of Psychiatry. So if they haven't done a DNA test for Fragile X, they need to do one.
Okay. All right. So we have one more question here. This person, it's a complicated question, so I will read it, and you can see if I read it correctly. So they're asking about folic acid and B12. I've read that Fragile X syndrome, fragile site, is folate dependent. Does it mean folate helps maintaining heterochromatin in this area and correct gene FMR1 expression? What about methylated folate, 5-methyl tetrahydrofolate? Does it influence methylation of promoter regions?
Those are very good questions. I think folic acid can be helpful in a supplement kind of way, so it's not dramatically helpful, but it can be helpful, and we did a controlled trial many years ago. The fragile site shows up in a folate deficient tissue culture media, but when you add folate, the fragile site doesn't show up. That has to do with media conditions and may not be related to methylation. So a lot of people don't really know why the fragile site shows up in folate deficient tissue culture media, but it does. But we don't diagnose Fragile X in that way. We use Fragile X DNA testing now. So there's a lot of controversy about whether there's excessive methylation or undermethylation in those with ASD, and whether folic acid will help with that or not. I don't think the supplementation of folate into flour has led to the increase in autism in our society. And in general, I think folic acid can be helpful for certain brain disorders, and it probably has to do with the level of neurotransmitters that are produced when there is excess folate. But a lot of that will require more research. So I hope that helps.